Thank you for joining us this hour. Here's what's coming up on Network Africa. Senegal eases coronavirus restrictions, allows mosques and churches to open. The World Health Organization predicts a rise in Africa's HIV deaths amid coronavirus pandemic. Plus, Madagascar's President Andre Rajoelina hits back at critics of his country's untested coronavirus treatment, known as COVID organics. Hello and welcome to the program. I'm Layo Adegoke. The coronavirus has infected 65,494 people across Africa. 2,319 people have died and 22,790 people have recovered. Let's take a look at all the countries that have crossed the 4,000 mark in cases. Now, South Africa has by far the highest infections on the continent with 10,652 cases, followed closely by Egypt with 9,746. At third place is Morocco with 6,281 cases, then Algeria with 5,891. And in West Africa, Ghana has confirmed 4,700 cases, while neighboring Nigeria has 4,399. Meanwhile, the countries with the most fatalities are Egypt with 533, Algeria 507, and South Africa 206. Now, Senegal is the latest African country to ease coronavirus restrictions. Mosques are now allowed to reopen for prayers during the holy month of Ramadan, and churches will also be allowed to accept worshippers. The nighttime curfew has also been reduced by 2 hours and will now run from 9 p.m. to 5 a.m. local time. Markets and businesses, which have only been allowed to open a few days a week during the lockdown, will now only need to be closed for a day's cleaning each week. In a televised address late on Monday, President Macky Sall said that Senegalese will need to adapt individual and collective behavior and learn to live with the virus. Joining us now for more on this is Ayola Popola. He's an IT entrepreneur in Senegal and he resides there. That's where he joins us from. Mr. Popola, thank you so much for speaking to us. Now, President Macky Sall says people need to adapt individual and collective behavior and learn to live with the virus. South Africa's president also said that to the citizens. Now, do the people get the message, especially in Senegal? Do they understand what this means?
Yes, good afternoon, Charles. Yes, the President Macky Sall clearly informed everyone about the steps that the government is taking in addressing the COVID-19 issues. Personally, in my opinion, people and individuals collectively and individually has to learn to live with the COVID-19. It's going to take a bit of time for people to get used to this and live with it and get out of it. And the message has been clearly communicated by President Macky Sall. And I think people are already respecting the dictates of the government on this.
Now, you've been resident in Senegal for a while. What do people make of this curfew, the reduced time, and what are the plans for businesses?
Well, businesses are going to be reopening in phases. At the moment, a lot of businesses are, for example, office enterprises are working from home. People are taking advantage of the virtual offices to get their meetings and conferences organized. So businesses are opening up in bits by bits. Fine, the market is opening, people are going to buy things and people are, there is really not a collapse of commercial activities here. The markets are still opening, but just lately, the government made an announcement that the frequency of markets opening will be reduced. It's going to be like 3 days in a week now, 3 times in a week now that the market will be opening for people to go out and kit up for their daily needs.
Yeah, you are a Nigerian in Senegal. I want to ask how, as you know, the lockdown and the pandemic affected you, your livelihood, and even other foreigners in the country.
Yeah, it's quite strange because we haven't seen this kind of virus before. So life hasn't been normal. Well, we are staying indoor, working from home, and once in a while we go out and do our stuff, and we back into the house before 8 p.m. the stipulated time that the curfew begins. But life hasn't remained the same. I'm telling you, it's been quite hard adjusting to the current situation.
All right, Ayola Pupola, an IT entrepreneur and a resident in Senegal, thank you for speaking to us. We do hope life turns out normal for you and others in the country. Thank you again. Now let's move on. The World Health Organization has predicted that over 500,000 people in sub-Saharan Africa could die from AIDS and its related illness amid the COVID-19 pandemic. The WHO says unless African governments take steps to address the issue, a number of Africans will die between now and next year. According to a modeling analysis done by the WHO and United Nations Aid, the disruption of antiretroviral therapy for about 6 months could cause Africa to record high AIDS-related death rates, as it did in 2008 when more than 950,000 deaths were observed on the continent. The executive director for United Nations Aid also warns that treatment could be interrupted with HIV services closed or unable to supply antiretroviral therapy due to the breakdown in the supply chain. Now, Madagascar's president, Andry Rajoelina, has hit back at critics of an untested herbal tonic that he is promoting as a treatment for coronavirus, despite it not having gone through clinical trials. Last week, the World Health Organization issued a warning against people using untested remedies for coronavirus. Nevertheless, the tonic, known as COVID Organics, has been sent to several African countries. Mr. Rajoelina says that criticism of the drink shows what he called Western nations' condescending attitude to traditional African medicine.
Madagascar is putting its self-proclaimed COVID-19 cure on sale, despite warnings from the World Health Organization that the plant-based remedy is not proven. A delegation from Tanzania has already collected their consignment, with Foreign Minister Palamagamba Kabudi saying Madagascar had made Africans proud.
And let me tell the people of Madagascar, you have made us Africans proud. You have made Africa proud. Because now Madagascar is providing, is contributing a solution to a global problem. We've been always used that it is Europe and Western Europe and other countries which do contribute to global problems.
The WHO Africa head has said she's concerned people who have drunk the product might feel they are immune to COVID-19 and engage in risky behavior. The WHO has said COVID-19 organics needs to be tested for its efficacy and any side effects. But as far as the country is concerned, it's providing a solution.
So there are some critics, there are some suspicion, but the most important thing is that we are offering a solution. to save lives and to help other people. And I think that is very important. And then everyone has a choice to accept it or not.
Madagascar has been giving away thousands of bottles of COVID-19 organics, which was developed by the state-run Madagascar Institute of Applied Research. Tanzania, Equatorial Guinea, Central African Republic, the Republic of Congo, the Democratic Republic of Congo, Liberia and Guinea-Bissau have already received thousands of doses free of charge. The African Union says it's trying to get Madagascar's technical data on the remedy and will pass that to the Africa Centers for Disease Control and Prevention for evaluation.
Meanwhile, Nigeria's task force on coronavirus says President Muhammadu Buhari has given the go-ahead for the importation of COVID organics, but officials say the import will be subjected to standard validation processes before it will be used on coronavirus patients.
It's been freighted to Guinea-Bissau by the president of Madagascar, president or prime minister, sent it to Guinea-Bissau. And certain allocations have been made to different countries. We have an indication of the quantity that has been allocated to Nigeria, and we are supposed to make arrangements to freight it out of Guinea-Bissau to Nigeria. I've received instructions from Mr. President to make arrangements to freight it home with a clear instruction that I should subject it to the validation process, similar to what would happen to any other medicine or syrup or vaccine that is discovered or created internally. So it will be subjected to the same process before it is put into any form of use.
We'll have more on the efficacy of COVID organics. We'll be joined by a doctor, consultant public health physician later on. But in the meantime, Tanzania's main opposition party, Chadema, has expelled 4 members of parliament who it accuses of going against the party's stand not to attend parliamentary sessions over coronavirus fears. The expelled lawmakers are Anthony Komu, Joseph Selasini, David Silinde, and Wilfred Rakatari. At least 10 others have been asked to explain why actions should not be taken against them for disobeying the party's instructions. The Chadema party, which has 62 out of 383 seats in parliament, had earlier told its MPs to self-isolate for at least 14 days and stay away from parliamentary buildings in the capital, Dodoma. The party's decision followed the death of 3 MPs in less than a fortnight, though the deaths have not been linked to COVID-19. The East African nation has not opted for strict lockdown measures, although mass gatherings at funerals and weddings have been banned. It has not updated its coronavirus cases since the 29th of April, when it confirmed 480 cases, including 167 recoveries and 16 deaths. Kenya's health authorities have announced that all patients being admitted to hospitals will have to be tested for coronavirus. The Director General in charge of health, Patrick Amoth, says this is to ensure that health workers are protected from infections when handling patients in hospitals. The new measure comes as Kenya's coronavirus cases rose to 700, including 33 deaths and 251 recoveries. The government has restricted movement in and out of the capital, Nairobi, and the second biggest city of Mombasa, as well as 2 other counties in the coastal region as part of the measures to contain the spread of the virus. It has also imposed a total lockdown in 2 areas identified as virus hotspots, one in Nairobi and the other in Mombasa, for 15 days. We have more on Network Africa still to come. To vote or not to vote? Well, it's the latter for the Ugandan president, as he says it will be madness to hold a vote if coronavirus persists. Details in a moment. Please stay with us.